All right, welcome, my friends, to a special edition of Extreme Health Radio. Thanks for joining us today on episode 643. This was sort of an extra, whoops, let me turn this off. I'm a little, just want to let you guys know that this is a special edition. This is episode 643. So if you want to grab the show notes, the links, anything we talk about, just go to extremehealthradio.com/643. I'm a little bit unprepared when it comes to the graphics and things like that, but we'll change those after the show. This is really going to be an awesome show, and I'm really excited to have Morley Robbins on the show again. As I've been diving deeper and deeper and deeper into his work and learning more about the root cause protocol, I was telling him before the show that I'm starting to see things in a brand new perspective when it comes to our health, and unknowingly, it may be one of the most simple things that you could ever do to radically transform your health. So I'm really excited about having him on, and we're going to talk about his relationship with iron, magnesium, copper, and some of these minerals, but we're going to talk about those specifically as they relate to, we're going to try to tackle pregnancy, diabetes, Alzheimer's, cancer, heart disease, and osteoporosis. And we were joking before the show that we could do a whole show basically just about pregnancy. So we're going to try to do our best to tackle some of those issues, some of those health challenges that the majority of people are having issues with today. And for those that have not listened to our previous shows with Morley, I would really recommend you go back and listen to those shows, because they will lay the foundation of what he likes to call the root cause protocol. And if you're unfamiliar with Morley Robbins, he was formerly known, I guess maybe he's still known as the Magnesium Man, but he's the founder of Magnesium, the Magnesium Advocacy Group, and the Root Cause Protocol creator. And now he talks a lot about magnesium, calcium, copper, iron, and these types of minerals, and how they balance out and how they affect our health. And so he does much more than just magnesium. So let me bring him on and turn his audio up. Morley, thank you so much for joining us, my friend.
You bet, Justin. Delighted to be here. Looking forward to our discussion, as always.
Yeah, I don't know. I mean, you and I were joking before the show. Can we get through pregnancy, diabetes, Alzheimer's, cancer? You said you could do a whole show on just pregnancy, right?
Yeah, absolutely. People have been so dumbed down about what's going on with pregnancy, particularly as it relates to minerals. So we'll see. We'll take a stab at it.
Yeah. It's interesting because one of our, it seems to me now women are having such a difficult time getting pregnant. It seems like it's a real issue in today's world, and that never used to be the case, right? It doesn't seem like it was years ago.
No. I think what people need to understand is we're in the fifth or sixth generation of mineral depletion. We go back over 100 years, and our ancestors had far more minerals in their soil and more minerals in their food than we have today. And while we look the same on the outside, we're basically like Swiss cheese compared to our ancestors. Mm-hmm. We just don't have the minerals. Just to keep it simple for people, there are about 9,000 enzymes that run the human body, and they all work just like the cars we drive. And people need to think about, when was the last time they drove their car without a key? Mm-hmm. They haven't done it, unless they're Wilma Flintstone or Fred Flintstone. And that mineral key is really critical. And when it's missing, the enzymes don't work, and then symptoms appear. So there are a whole lot more symptoms today. We can certainly agree on that. It's very commonplace for people to be on a lot of medication. I just turned 67 by the grace of God. Knock on wood. I don't take any meds, wow. But I've got friends. I've got peers of mine went to school with, who they're taking anywhere from 5 to 10 medications. It's ridiculous. So I think that it's a significant issue, and particularly as it relates to this dynamic of pregnancy. Mm-hmm. No, you're absolutely right. The increase in the number of people who struggle to get pregnant is significant, both on the male and the female side. What's interesting is if we were critters on the farm and we were having trouble conceiving, there's only one nutrient the farmer would add to the feed. It's called copper.
Mm-hmm.
And people think, well, it can't be that simple. I mean, why did I go through this IVF program spending $20,000 a pop?
Mm-hmm.
It's because your doctor didn't know about copper, wasn't trained in copper. I was talking to a client in the UK about 2 months ago. She had 7 miscarriages and 2 ectopic pregnancies, and she was a copper desert. She never knew that that was what the origin was. And so I think it's a very significant issue. And so what happens is if the individual can't conceive, that's the body's way of saying, you don't have the wherewithal to support this offspring.
Mm-hmm.
You don't have the ability to nurture them over the course of 9 months. And it's a self-protective mechanism by the body. And then people who force the pregnancy, they don't realize what disruption that's creating for the offspring.
It's so interesting. So what is copper doing that helps a woman to hold on to the baby or to get pregnant?
There's a tremendous amount of oxidative stress. Again, the movement of electrons is really important in the body, and the process of impregnation.
Mm-hmm.
I hope that's the right word. Implantation. There's a tremendous amount of exhaust given off, and the copper is instrumental to make sure that is minimized, so that there's the greatest chance for implantation.
So is it the fact that there's well, I guess, I mean, you can't really talk about these things in isolation, right? You can't talk about copper without, talking about iron. So I was going to say, is iron also at play here with regards to the lack of bioavailable copper? It has to be, right?
Absolutely. And that's the work of probably the most noted scientist I can identify, Jamie Collins over at the University of Florida in Gainesville. He's done an amazing series of studies, 2016, 17, and 18, looking at the relationship between iron and copper, but particularly as it relates to iron supplementation and its impact on copper metabolism. And it's an oh my God moment. People don't realize this prevalence of iron in the one-a-days and the supplements that they swear by because I'm anemic.
Mm-hmm.
It's devastating their copper metabolism, and it's weakening it. And what's really hard to imagine is what we're talking about in a healthy body. There's about 4,000 milligrams of iron in a woman and about 5,000 milligrams of iron in a guy.
Mm-hmm.
And there's about 100 milligrams of copper. So we're talking 50 to 60 to 1 ratios.
Mm-hmm.
And so big differences in the impact. And it doesn't take a lot of copper to keep that iron in check. But if it begins to get overwhelmed and depleted by food agents and medicinal agents, pharmacological agents, it has a profound effect on the homeostasis of the body.
So is copper, I'm just trying to make sure I understand this, is copper itself is being depleted just because of a lot of reasons, our soils and things, but just the very fact that we are now doing the iron fortification program, just adding the extra iron, is that also affecting the copper?
Well, let's put it in perspective. Copper is the number 1 nutrient deficiency on the farm. It's been that way for 60 years. And the addition of NPK after the First World War did us no favors because NPK blocks absorption of copper. The introduction of Roundup has been devastating because it chelates copper. The addition of high fructose corn syrup in the 70s and 80s to anything liquid has been amazing. If people are wondering, well, where's high fructose corn syrup? It's at Starbucks would be the first place you'll find it. And then that's on the copper side, and we haven't even talked about the medications
Mm-hmm.
that block the absorption of copper, or ascorbic acid that blows up the ceruloplasmin protein
Mm-hmm.
to release copper. So there's a lot of flux on the copper side, and then we come to your point about the iron side. Iron fortification began in 1941. It was increased 50% in 1969.
Mm-hmm.
Uh, the introduction of folic acid was devastating. It has a very significant impact on iron status, not in a good way.
Mm-hmm.
Um, and the growing prevalence of anemia and the belief that low iron in the blood means that it must be low in the tissue, when in fact it's just the opposite.
Mm-hmm.
So when you add more iron to your body because of supplements or maybe an infusion or two, as many of my clients have done, it has a very significant effect. And then I was talking to a client just yesterday. She had very heavy menstrual bleeding,
Mm-hmm.
so she had an ablation when she was in her early 40s. Well, her menstrual cycle stopped.
Wow.
Well, now she's 55. I said, did anyone point out to you that you should be doing blood donations or anything? She said, oh, no. So she's had about 12 years of no blood loss in a body that's perfectly designed for blood loss.
Mm-hmm.
Well, now she's got depression, anxiety, osteoporosis. She's a hot mess.
Wow.
She had a kidney stone, all because of this rising tide of iron in her body that no one told her was building. Oh, and then just to add insult to injury, she was working with an alternative practitioner who had her taking 8,000 IUs of vitamin D every day for
Oh no.
years,
Wow.
not knowing that that was increasing her calcium load.
Mm-hmm.
I mean, it's just so, again, this is anecdotal. I know it's an N of one, but I've talked to thousands of people with these types of dynamics, and so there's been this juxtaposition of the loss of copper, the rise of iron, in bodies that are designed for a very delicate balance between the two, and the growing level of oxidative stress and its second stage, which is called inflammation. Every condition that we are familiar with, any chronic condition that your listeners are familiar with or experiencing,
Mm-hmm.
has inflammation attached to it. Well, what is inflammation? It means there's a rising level of hydrogen peroxide.
Mm-hmm.
Well, why is the hydrogen peroxide going up? Because there's no bioavailable copper to
Mm-hmm.
to either turn the oxygen into water, H2O,
Mm-hmm.
or neutralize the H2O2 with catalase or glutathione peroxidase. And so the rising level of hydrogen peroxide, it's a signaling molecule under physiological conditions, but when it gets too high, it becomes corrosive. And so that's what's challenging a lot of people, particularly people trying to get pregnant.
So when you were talking about blood donations, and this is something that I've been just started now, I've been involved in this health journey since 2003, and I'm only now just getting into regular blood donations. But would you recommend it for women who are trying to get pregnant or are already pregnant, or is that something that you don't normally?
That's a great question. No one's ever asked that question. Um, I think what I would start with is I would encourage people to get what's called the Full Monty Iron Panel
Mm-hmm.
that looks at a variety of minerals: magnesium, zinc, copper, several different facets of iron, looks at their retinol level, vitamin A, and their vitamin D level, gives them a better context for to what extent is my body in balance. And the concern I have with modern obstetrics today is there is a complete obsession and preoccupation with iron status measured by ferritin, which is a
Uh-huh.
very misleading marker for iron status, and there's a preoccupation with vitamin D, with no consideration to how important retinol is to the developing fetus, no consideration given to how important bioavailable copper is to the developing fetus and the mother. And what a lot of women do not know, and neither does their obstetrician know, that at the last trimester of the pregnancy is where some very important dynamics take place.
Mm-hmm.
And there's a very, you and I are adults. We have livers that have about 7 milligrams of copper in them.
Mm-hmm.
That's considered normal. About the same amount in our brain, too.
Mm-hmm.
Liver and the brain are the two highest concentrations. But when you and I were born, if everything went well and mom was doing okay, we were born with livers that had 70 milligrams of copper.
Mm-hmm.
And that forms the basis of our immune system in the first 2 years of life, because we don't really have an immune system years 0 through 2.
Mm-hmm.
And then under ideal circumstances, we get a download of retinol from mom with breast milk.
Mm-hmm.
Right? And what is important for the listeners to understand, particularly the ones who do want to get pregnant or are pregnant,
Mm-hmm.
the 90% of the cells in breast milk are macrophages. Well, macrophages are the Pac-Men that gobble up the bad guys. And so the baby is getting an enormous download of these macrophages, which
Mm-hmm.
is really important for their immune system. And during that period of breastfeeding, and it ideally would be about 18 months, but not everybody does that. And many people do use formula. Well, what's the focus of formula? Got to get a lot of iron, got to get a lot of vitamin D. Well, there's no iron and vitamin D in breast milk. Thank you very much.
Mm-hmm.
A lot of those formulas have a lot of estrogen. I've seen it in some studies that males are being exposed to 25,000 times more estrogen in the infant formula than they should be as a male, which is having a decided effect. Yeah, it's just a tremendous exposure to estrogenic factors.
Uh-huh.
And so the B vitamins are not real. I mean, there are many reasons why the formulas are just very challenging at best, but not everyone can breastfeed, and I respect that. But there are
Mm-hmm.
other formulas that they can use. There's goat milk formulas and a variety of other things. But the important thing is the download of minerals is very significant. And then what I just learned about this past weekend is that the vagal nerve tone, I'm sure you're familiar with the vagus nerve and
Mm-hmm.
its importance to run the autonomic nerve system.
Mm-hmm.
The infant gets the vagal tone from mom. So if mom is chill, baby's chill. If mom's a stress cadet, baby's a stress cadet. And so there's 3 really important things that the baby gets from mom. 1, mitochondrial DNA,
Uh-huh.
very important.
Right.
Second, the download of minerals, especially copper and iron, which we'll talk about in just a minute, because there's a very specific mechanism for getting iron into the fetus that not a lot of people know about. And then the third is vagal tone. Why is the vagal tone important? Because if the baby is a stress cadet, it's going to be constantly going through minerals. I call it the magnesium burn rate.
Mm-hmm.
If the baby is agitated, if the baby is reactive to its environment, if the baby is reactive to its food, well, it doesn't have good vagal tone. And magnesium, potassium are very important for that vagus nerve. So there's a lot of incomplete information, I think, on the internet about pregnancy and how important the mom's health is relative to that.
Yeah, it's interesting because you talk about how 36% of the Earth, the makeup of the Earth is iron, and somehow we're anemic, right? But you combine that with a lack of copper, way too much iron, and EMF and stress and everything else, and a lack of magnesium, and you wonder why women can't get pregnant. And then if they do, what's kind of scary to me is something you mentioned before that I didn't really think about. When you think about in vitro fertilization, where women are forcing themselves to be pregnant, essentially, in a body that is quite clearly saying, I'm not ready, or I'm not, I don't have enough minerals to be pregnant. So then you're sort of forcing, and then what burden does that have on the mom, you know?
Well, it's a burden for both mom and the baby.
Mm-hmm.
And the one of the myths that runs the planet Earth is babies are born perfect.
Mm.
That's not true. What actually happens is the baby will take whatever it can get, and the the offspring will get priority. Well, then we're talking about a mom who's going to be depleted, and there are a lot of women who are really altered by the pregnancy. The way I describe it is that the bookends of stress on the planet are guys in foxholes worrying about death,
Uh-huh.
and moms in birthing suites worrying about life. And those are the two biggest stressful events on the planet.
Mm.
A car accident would be secondary to those, and then right on the heels of the car accident would be insomnia. So stress comes in many forms. EMFs is the latest iteration of stress on the planet.
Mm-hmm.
It's very significant, especially in bodies that don't have good mineral mass, especially in bodies that don't have a good status of magnesium. And what does the EMF do? It agitates the L-type and T-type calcium channels.
Mm-hmm.
And who's guarding the fence in the calcium channels? It's called magnesium.
Uh-huh.
And so magnesium leaves the calcium channel. And you would think because it's called a calcium channel that calcium would come in, right?
Right.
No, it's actually iron that comes in. And it only further aggravates the oxidative stress on the cell. And so, again, I'm in no way defending EMFs. I think they're completely toxic. But what is happening is society is being overwhelmed by silent poison. So we have fluoridation in the water. We have EMFs in our airwaves. We have, chemtrails. We have all sorts of, we have glyphosate in the field. We don't think about that. We don't think about the fact that they keep adding more and more iron to our food. And it's just, so there's all these different layers of stress, and there are thousands of different forms of stress, but there's only one pathway that stress follows in the body. Stress causes magnesium loss. That then affects the electrolytes. That then affects, there's energy loss that follows that.
Mm-hmm.
Well, if there's energy loss, then eventually there's going to be cell death. And the cell death is followed by inflammation, which is a natural bodily function to get rid of dead tissue.
Mm-hmm.
But that's acute inflammation. Today we are suffering from chronic inflammation because the body can't get out of that pattern. And then what is inflammation followed by? Fibrosis.
Mm-hmm.
And so that pathway of responding to stress was developed by Dr. Fiedler in 1899. That pathway is what runs our response to stress, whether it's EMF or food toxins or glyphosate in the soil, or you had an argument with your wife, mm-hmm. or you don't like your job, or you were just in a car accident. All of those stressors have the exact same response physiologically.
Mm-hmm. Yeah, and you mentioned,
and so that flies in the face of people's belief that they're unique and special.
Yeah, it's so fascinating because you talked about even iron overload itself induces the fear factor in people, and many fearful people are overloaded with iron. And I'm curious, when it comes back to pregnancy, would you recommend then women get that full Monty blood test probably before pregnancy? But if they're already pregnant, would that be something they should still consider, do you think?
Well, I think what's important is people need to, I think a really good source of information around pregnancy and around early life is provided by the Weston A. Price Foundation. I think they have a wonderful series of articles, and they've got a website devoted to helping people with feeding their children. I think that's a good source of ancestral education. I think people, again, when we're talking about couples that are having trouble conceiving, guess what? Guess what the dominant emotion is? It's fear,
Always
right?
fear,
Yeah,
right?
it's fear. It's like, oh my
Yeah,
God, I'm not going to be able to have a child.
yeah.
I had planned to have a child now, and if I can't have it now, it's really going to screw up my whatever. And it's like, so there's a lot of emotion tied to this.
Mm-hmm.
And so I think that people need to step back and get better educated about what did our ancestors eat who were raising families, our grandparents, great grandparents, great great grandparents. They were pretty savvy people.
Mm-hmm.
They were very simple. They didn't have cell phones. They didn't have the internet, but
Mm.
they had very happy and productive lives. And they had children.
Mm-hmm.
And as you pointed out, they didn't usually have trouble conceiving. It's very
Yeah.
rare that our ancestors would have had that problem.
Yeah.
But I think it's important for people to ask more questions of their practitioner. So why do I need this vitamin D in my prenatal? I'm as a rule, I do not recommend people taking prenatals.
Mm-hmm.
What my wife, who's a chiropractor and mother of 5 children, all home birthed, and she has a very active practice with pregnant women.
Mm-hmm.
She uses the standard process Catalyn product, Catalyn. It's a broad-based supplement that is very helpful for women trying to get pregnant and supporting their child. Um, but it's not riddled with a lot of fake and phony nutrients, and it's not iron fortified and all that stuff. So I think people need to really do some research. I think people need to really understand, why is there no iron in breast milk? Why is there no vitamin D in breast milk? It's an important. Why would Mother Nature design breast milk that way? And why are we now consuming substances that are violating Mother Nature?
Mm-hmm.
That on the surface, that doesn't make sense to me at all. And so I think a lot of people are getting swept up in the world of convention, and I think it's time for take a time out and really
Mm-hmm.
study what's going on.
It's fascinating because my wife and I were just talking about this morning about the relationship between, polyunsaturated fatty acids, cholesterol, and sunshine, and vitamin D, and you combine with the Iron Fortification Project, and it almost makes you, if you have sort of a conspiratorial mind, and you kind of think that maybe people really know a lot more about this than they're saying, it almost makes you kind of think like they're raising iron in ungodly amounts in our food, and we're already getting it from the soil and acid rain and everywhere else. And then they're lowering copper, and then they're telling us to take vitamin D and telling us to don't eat anything with cholesterol or no fat, so you can't make vitamin D from the sun. I mean, it almost just seems like this perfect storm, doesn't it? It's really bizarre.
Well, absolutely a perfect storm. And one of my favorite quotations from Ray Peat, who's a world-renowned lipidologist.
Mm-hmm.
It's one of his articles that talks about iron. It's not the one that I sent you earlier, but there's another one that's fascinating.
I'll show that anyway.
And in his article, he says, sunshine is what keeps copper from becoming iron. And I've thought about that. I've never had a chance to talk to him personally. I would love to do that someday, because I think he's
Yeah.
sunshine
Uh-huh.
is what keeps copper from becoming iron. So anyone thinks about sunshine, the first thing they think about is vitamin D. We've been conditioned, it's been programmed into
Right.
us.
Right.
What people do not understand is that sunshine also has a secondary function, which is probably more important than vitamin D, and that's to initiate the breakdown of vitamin A into its component parts.
Mm.
And so retinol becomes retinoic acid, and there's 4 of them that I'm aware of.
Mm-hmm.
They're all hormones. So all trans, 9-cis, 11-cis, and 13-cis retinoic acid are all very powerful hormones inside the body that do amazing metabolic functions. And then there's a whole series of nuclear receptors that are retinoid based. And Nobody talks about that. Well, what retinol also does, and we may have talked about this before, but just to reinforce it, retinol works to make sure that in the inside the cells that copper can be loaded into enzymes, the most important of which, of course, is ceruloplasmin.
Right.
And it's retinol that enables that process to take place. Well, what's the most important enzyme that ceruloplasmin expresses is called ferroxidase, and it's what prevents iron from becoming reactive and toxic in the body. And so I think what Ray Pete is alluding to is we need that sunshine to break down the retinol, to make the copper bioavailable, to keep the iron at bay. And if that isn't there, then the iron does take over and it becomes much more prevalent in our body. And people need to be aware of that delicate dance between copper and iron and how important the sunshine and retinol is to enable that process to unfold properly. And again, the optics of pregnancy are all about vitamin D. Nobody's talking about retinol. It's incredibly important. And when you study fetal health, I would encourage the listeners, just Google fetal health retinol deficiency, and they're going to be shocked at what pops up. And what's important for people to understand is that the unopposed vitamin D supplements will block the absorption and the utilization of retinol. In Mother Nature, whenever you find A and D, they're together. They're not isolated from one another. And there's always at least 10 times more retinol than there is vitamin D. Now, why would Mother Nature do that? Maybe because retinol is really important, or maybe because vitamin D is really powerful. It's the oldest hormone on the planet. It's the most powerful hormone on the planet. And so Mother Nature has a bunch of retinol to keep it in check. And people taking, 2,000, 5,000, this client, 8,000. The course record for me is a client in Buenos Aires whose doctor had him taking 250,000 units of vitamin D.
I've heard about that, yeah.
And didn't understand why he was so sick. So people have lost their perspective about how does Mother Nature design the food system so that we can stay in balance. And that's really what the design of the root cause protocol is to help us come back to that basic set of variables.
Yeah, it's interesting how intricately connected these things are and the ratios between each other. Like you just mentioned A and D, and then also calcium, magnesium. It's like these things, copper and iron, these things are, delicately balanced in our bodies, right? And when you start throwing it off by doing like 250,000 milligrams, I've heard even hundreds of thousands IV, and it's just like, wow, it's got to be throwing off so many different systems just doing that.
Yeah, and I think a lot of practitioners of all different fields of training have a very mononutrient focus. They think, oh, well, your vitamin D is low, or oh, your calcium is low, or oh, your iron looks low, and they don't think about what you're talking about, which is nature is all about yin yang. So everything's in harmony, everything's in balance, and it's not that they're equal, but there's a set ratio depending upon what the factors are, and we need to have that balanced perspective and that understanding that there are these very delicate ratios that drive the physiology of the body. And what I appreciate, Justin, is you keep talking about copper and iron. Well, most people have been trained to think about copper and zinc, the zinc copper ratio.
Right,
my zinc copper ratio is all. It's like, scratch that record. That's not the ratio that matters. And I'm really glad the listeners are hearing that again and again, that it's really this relationship between copper and iron. Why? Because they're the only two metals on the planet that have any relationship with oxygen. And iron carries it, but copper activates it. And that's the important distinction for people to understand.
Super, super important. I hope you guys are enjoying this show with Morley Robbins. His, if you guys were listening on the podcast version, I cannot recommend him and his work enough. His website is rcp123.org. It's kind of a nice little rhyme there, rcp123.org, and you can find out more about the root cause protocol. And I was telling Morley before the show that, you know, we've done over 600 and actually over 650 interviews, and I've been involved in natural health and natural healing since 2003. And I've probably listened to over 10,000 hours of podcasts. I've listened to, all I do is I just listen to health radio shows and things like this. And his work and the things that he's talking about, I think, are so groundbreaking, and it's so complex, but yet so simple. So I would really recommend going over there to the root cause protocol, learning more about what he's doing, and the intricate balance between some basic minerals, copper, iron, magnesium, calcium, and then vitamin A, and learning how these things interplay within your body. And I'm telling you, if you get these things regulated in your body, you'll see dramatic changes in your health. And I just cannot recommend him and his work. I've been having so much fun researching him and learning more about his information. And when we get back from the break, we're going to talk about diabetes, or diabetes, as some people say. And we're going to talk about some things that he mentioned before the show, some new research about diabetes. So if you know of anybody, maybe turn them on to this show. And we will be right back.
You're listening to Extreme Health Radio, and I hope you're enjoying this show. Please share it with your friends by tagging at Extreme Health Radio on Instagram. Stay tuned for new shows weekly.
Yeah, so right now we're doing 2 shows a week on Mondays and Fridays, live on Facebook and live on YouTube, and trying to make sure that everything's free and available to everybody, and that way you can stay up to date with all of our shows and all that kind of good stuff. And if you follow us on Instagram, it's always kind of fun for as long as we have the platform. We don't know how long we're going to have it because, you know, we're getting some strikes and some weird things happening on YouTube. So I don't know how long we're going to have these platforms, but as long as we do, we might as well utilize them to the best of our ability. And one of the things I wanted to talk with you guys about, I was doing some research recently and I was learning about the amount of chemicals that are in our environment. 60,000 chemicals, new chemicals in our environment since the early 1960s have been introduced, not counting the acid rain, the chemtrails, all of the iron that we're being overexposed to, the different fire retardants, chemicals in our beds, environmental toxins, tire dust, airplanes, all these types of things that are in our environment. 60,000, and then there's 84,000 in commerce at any given moment. And it's just like chemical soup overload. And I wanted to share with you a really cool way that we like to detox, and that is using a relax far infrared sauna. And we just sold one to a lady this morning, and these things are just great. I use mine every single day. I love it so much. And listen to what Dr. Robert Rowan had to say about sauna therapy. Pretty cool.
It's one of the biggest. The other issue is chemicals in the environment. And to get rid of chemicals in the environment, probably the most cost-effective method is to sweat them out. And far-infrared saunas is going to help sweat them out. I mean, look at the breast. What is the breast? It's 90% fat. It's only 10% mammary tissue. So the fat of the breast is going to store all these poisons, which act as estrogens, and hold it right up against sensitive mammary tissue.
And so these toxins get stored in the fat cells, and you can sweat these things out.
It's been shown that when you sweat in like far-infrared saunas, you actually can begin downloading toxins from your body.
Yeah, and there's all kinds of really cool and interesting protocols you can do, to help increase the amount of sweat that you excrete through your skin. And, a lot of these toxins get stored in not just in our lymphatic system, but also in our fat cells as well. And so when the far infrared light actually interacts with our fat cells, it sort of oscillates the fat cells and causes that to ooze out, and you sweat this out in your sweat. And it's a really great way, in my opinion, to have something like this that you do every day, or at least 3, 4, 5 times a week. There's lots of research and information about sauna therapy and sweating and detoxification. Really great tool to have in your home. And also, a little thing that I like to sort of combine with it is this rebounder. So listen to what Judy Mikovits had to say about rebounding. Rebounding is really fun. I like to do it right before I go in the sauna. You kind of jump up and down. but check this out.
And let's think about the simplest thing. I used to do one of those rebounders for exercise back in the 80s and things like that. And it's a wonderful way to move your lymphatics, because a lot of these toxins simply clog up the highways. Think about LA. That's why I take the train, because you can't get there from here. There's so much road construction, narrowing down to 3 lanes here and there. That blocks it all up. That's with the lymphatics. That's with the blood. That's why we see all this swelling and inflammation. And then all of these toxins are talking to the cells that say, I have to go repair. And overdoing repair causes cancers, because you need to turn that off.
Yeah, that was a really fun show we did with Dr. Judy Mikovits. She's really, really cool. She wrote a book called plaguethebook.com, and pretty cool stuff. But here's the rebounder that we have. It's called the Bellicon rebounder. And what I love about it is that it uses these flexi ropes. So it's kind of like jumping on a kid's trampoline or something. It's silent, but you don't have to work hard to really get air. And I love it because it's silent. The legs can fold, so you can store it underneath your bed. It lasts forever. I mean, the thing is so well made and so well built. And I like to do it for about 10 or 15 minutes. Sometimes I'll do it in front of a red light, and then I'll go in the sauna afterwards. It's just a really cool thing to have in your home. And I really encourage you, if you're listening to this, to look at some tools like this that you can bring into your home and turn your home into kind of like a little healing sanctuary, and make it something where you don't have to go out to a gym or go anywhere like that. You can bring these things home and use them at home. And so it's something that I really, really strongly recommend. And it's called the Bellicon Rebounder. So you can check that out. And if you guys want to check them out, I think we have a Black Friday section on our store if you guys are interested in looking at the Bellicon and seeing if there's any Black Friday deals. But check those out. We'll put links to them at extremehealthradio.com/643 if you're listening. And that way you can learn more about it and what it can do for you. And we'll be right back with Morley Robbins. If you guys have any questions in the chat room, we will try to read them on our YouTube page if you type them in all caps. And if you have any questions about diabetes and you want to call up, our Skype should start working, or should be working right now. Our handle on Skype is Extreme Health Radio, all one word. And if you have a question about diabetes, when we come back, we'll ask Morley, and we'll be right back after this.
This is Extreme Health Radio, where we're 100% listener supported. Make sure to join the Extreme Health Academy with thousands of other listeners and get real solutions for your health challenges.
All right, we're with Morley Robbins. His website is rcp123.org. I just love the way that sounds. Rolls right off the tongue. rcp123.org. And we're going to bring him back up on real quick. And so let me bring Morley up. So, Morley, you were telling me before that you have some new insights on diabetes. Is that correct?
I do. And before I do that, let me just make a couple quick comments about some of the information that you were sharing. Really love what Dr. Mikovits is talking about. When lymph isn't moving right, there's too much iron and not enough bioavailable copper. And so whenever the highway starts to get backed up, whether we're talking lymph or blood, you got too much iron. So I think it's good for people to know that that's a very primal dynamic that really will affect them. The other thing, real quick, with a very little known function that's in the placenta of the mother is an enzyme called zyclopen, Zyklopen. Dr. McCardle, MCARDLE, and his team, 2010, 2012, have been instrumental in explaining the importance of the zyclopen enzyme, which regulates the transfer of iron between mother and child.
Oh, okay.
Now, what's important about that enzyme is that it is copper dependent.
Okay.
And not many people have enough copper to spit at. And so I worry about what is really going on with iron transfer between mother and child when the cyclopen enzyme is not working properly. And there's very little research about that. There's very little in the literature that speaks to that issue. So I just want to emphasize for people that if they want to be really at the cutting edge, everybody wants to know what's new. Well, cyclopen enzyme is hot, and they can ask their obstetrician about it and mention Dr. McCardle's name and ask the obstetrician, so can you help me understand what this prenatal is going to do as it relates to this vital enzyme that's going to be managing the flow of iron between my body and my infant's body. So be ready for a very uncomfortable exchange with your obstetrician, but I think people really have got to get more aggressive about getting fundamental, factual information about what's really going on inside their pregnant bodies.
So could they test for this?
Absolutely.
Yeah.
Yeah, they can. But does the FDA allow it? Probably not. So that's the dilemma, is that this is another form of ferroxidase enzyme function. And again, the two most important enzymes on planet Earth are in complex 4 of the mitochondria. Cytochrome C oxidase allows us to work with oxygen, and ferroxidase prevents rust.
I see.
Those are the two most important enzymes on the planet, and neither one of them is a regular part of any blood panel. And it's a really good question to ask, why? Why wouldn't we have that? And that would be a very primal understanding about whether our body is working or not. And it would really help us to manage this condition called diabetes, which we'll get into.
Yeah, so how do these, because you were saying before the show, that before we started recording, that this whole business of insulin and all this stuff related to diabetes is just sort of like this old information, or it's just not completely accurate, right?
Well, it isn't necessarily old information. It's where all the optics are.
Okay.
Everything's about, oh, you're insulin resistant. Well, let's move the focus back a few years. I came across some very interesting research from the early 1970s by Dr. Fetal, who's a noted biologist in England, studying farm animals. It's always interesting. There's no disease on the farm. Plants don't have disease, and animals don't have disease. They just have mineral deficiencies.
Right.
But the farmers have disease, right? Because they believe their doctor. Right?
Yeah, totally.
So the Dr. Fetal was studying copper deficiency in animals on the farm.
Okay.
And the first thing he talks about is the animals who are copper deficient have a breakdown of their pancreas.
Okay.
I was like, what? I've read a lot of articles. I spend 3 hours a day pouring through the literature. I'd never read that.
Yeah.
So I started chasing that bunny trail just a couple weeks ago. And in fact, Dr. Fetal is absolutely right. It was studied very intensively by a Dr. Rao, R-A-O, at Northwestern University. From 1985 to 1995, that was his focus, was how dependent the pancreas is on copper.
Okay.
So the pancreas is a dual function organ. It has endocrine function that everybody knows about, which secretes insulin. But it has something called an exocrine function that makes all of the digestive enzymes that we rely on. And the way the pancreas sits, it sits right next to, if this is the small intestine, the duodenum, well, the pancreas is sitting right on top of it.
Okay.
And the cells that are so important in the pancreas are called acinar. A is an atom, C-I-N-A-R, acinar cells. And they're very energy dependent. They can't do their work without ATP.
Okay.
And if they lose copper, they can't work. And in a series of studies that I was looking at, within 8 weeks of depriving animals of copper, there was a 90% loss of their acinar cells. And just so people understand, the two most important enzymes that the pancreas makes are amylase and lipase. Well, amylase is what breaks down carbohydrates, and lipase is what breaks down fats. Where does the amylase secretion start? When you start to chew your food. And if you have a meal that has a crunch to it, you start to release amylase in your mouth that works its way down your esophagus into your stomach and helps you to break down the food.
Okay.
That doesn't work if you're drinking smoothies. So I always encourage clients to stop drinking smoothies and start drinking choozies. So they have to chew. And that's where it's a very important aspect of digestion. But when the animal loses amylase function, it becomes more reactive to sugar. It becomes glucose intolerant. And it turns out that as this process unfolds inside the pancreas, years before insulin becomes an issue.
Okay.
But as this process unfolds, these acinar cells undergo what's called transdifferentiation. That's a big word. And they turn into liver cells. They're called hepatocytes.
Okay.
And you're like, huh? Wait a minute. So these acinar cells that get transformed into hepatocytes, and it begs the obvious question, why would the pancreas start to develop hepatocytes? Well, you have to understand what hepatocytes do inside the liver. They regulate copper. And so the pancreas is desperate to find copper, and it will go to great lengths to make sure it has copper. It will transform its tissue to become copper-seeking, copper metabolic, so that it can in fact get its function back. But here's the catch. Once these cells turn into hepatocytes, they can't go back. And then you've lost that ability to make those enzymes. And so anyone who has gut dysbiosis probably has pancreatic dysfunction from a lack of copper. Anyone who has leaky gut, a lot of people worry about their leaky gut, right? It's because the cells, these are the enterocytes, well, the enterocytes have pulled apart. How do they stay together? By energy. Where does the energy come from? It comes from copper. And so leaky gut, enzyme dysregulation, all because of a lack of copper. And people are probably thinking, well, why is the copper missing? Well, I have a very dear friend now. He was a client who's become a very good friend. Very, very high-profile chemist who, when he came from India to the United States at the age of 22 to go to Hopkins to get his doctorate in chemistry, he adopted the Western diet.
Oh.
And he fell in love with Coca-Cola.
Oh, yeah.
And didn't know that there was high fructose corn syrup in Coca-Cola. And when he found out there was, he didn't know what the impact was. Well, what does high fructose corn syrup do? It stops the absorption of copper in the intestine and blocks it in every other cell that has the doorway called CTR1, copper transporter 1. And so that's where diabetes starts, is the lack of copper that affects the pancreas. And when the pancreas loses its ability to break down sugars because it doesn't have amylase, it sends a signal to the endocrine end of the organ.
Okay.
And it says, you better start making a lot of insulin because we got a problem. And that's when you start to have this miscommunication and dysfunction in the pancreas. And And what is that insulin doing? Well, that insulin affects gene function, which then prevents the ability to make and function with ceruloplasmin. And the cells can no longer, the tissue can no longer make ceruloplasmin to fight the oxidative stress that's rising in the body that has rising levels of sugar. And there's a direct correlation between rising sugar and rising oxidative stress. And nobody's talking about all that stuff that happens years before you have what's called liver insulin resistance or muscular insulin resistance. And so we live in a world that obsesses and is preoccupied with iron, has no vision for copper, doesn't understand what copper does inside the body. And that, let me put it in perspective, Justin. To be classified an epidemic, 7.7% of the population has to have the same condition. Okay. The percentage of people in the United States that have a sugar disorder, 32%. This is a very serious problem in this country about sugar metabolism disorders. And the scale of it is really big. And we all love our sweets, but we are increasingly inside bodies that don't have the very mineral that allows our body to break down the food that we're eating, especially those sugars.
Now, are you seeing any difference with type 1 and type 2 diabetes? Because everyone I talk to, obviously there's a difference there, but then you get to some of the people that we speak to on a radio show and they say, I don't care what kind of cancer it is, it's all a dysregulation of the body, it's a metabolic disease, and you can treat a lot of these things the same way. In your research, are you seeing a difference between type 1 and type 2?
Well, the classic distinction between type 1 and type 2. Type 1 is the inability to make insulin.
Right.
And type 2 is the inability to handle sugar and to regulate insulin. And then eventually, type 2 develops into a situation where the body is stressed to make insulin. Now, here's where it gets really wicked. You're sitting down, right?
Yeah, I'm sitting down.
You're sitting down, okay.
Yeah.
So I came across a very important study by Dr. Gozileh, Gozileh, 2017, talking about how iron creates diabetes. Like, what? And basically what he says is if you want to create diabetes, add iron. And if you want to stop diabetes, chelate iron. Very, very powerful statement. So then what we find out is that a lot of people who have type 2 diabetes take metformin. You probably have heard that.
Right.
Now, I want you to go out on a limb. You're a smart guy. What metal do you think metformin chelates to perform its function?
Oh, gosh. Copper?
It does chelate copper. And the rationale is, well, this pesky little copper is causing all the problems that are called diabetes, when in fact it's entirely iron driven. And so they're robbing the very metal that can stop this chaos. Okay? And then a lot of people take insulin on top of their metformin. And what's that insulin doing? It's only adding to the insult, because there's a gene transporter protein called FOXO, FOXO, and that gets shut down with too much insulin, and then you can't make ceruloplasmin. And so people aren't aware of that. They've never heard of ceruloplasmin. They don't know what it does. The doctor doesn't know what it is, and the doctor's just trying to get the blood sugars down, right? But we're not focusing on the right thing. How did the blood sugars rise in the first place? What happened to the pancreas years ago? And again, in this situation with my friend client, he was drowning himself in Coca-Cola, and he developed non-alcoholic fatty liver disease by the age of 37.
Mm-hmm.
And by the time he was 40, he had type 2 diabetes. And he's absolutely fascinated by what he didn't know about the mineral dynamics that affected his pancreas, his liver, and is now affecting his overall health. Because there's a very high correlation between diabetes and heart health, eye health, brain health, bone health, kidney health.
Mm-hmm.
It's a gateway for a lot of conditions, as you well know.
Are you seeing a lot of people that have turned around their diabetes type 1 and type 2 following the root cause protocol?
There are striking examples where people are able to reverse their type 2 diabetes, and it's not just from the root cause protocol. Dr. Wong, Jason Wong,
Mm-hmm.
Is it Wong or Fung?
Or Fung, yeah, Fung.
Fung, excuse me.
Uh-huh.
Jason Fung has an entire protocol based on fat and lipids.
Mm-hmm.
Another naturopath that I'm familiar with, his name is Stefan Ripich. He's a naturopath in Arizona. He has a wonderful book called The 30-Day Diabetes Cure. And his track record is 100% of his type 2 patients are no longer on insulin, no longer on medication. And 80% of his type 1 patients are able to reduce their insulin. So those are pretty striking statistics that he's kept track of.
Are those
I
doctors,
just think it's important for people to realize, know that there are solutions. Yeah.
Are those doctors understanding of the role of minerals, specifically copper? Do they work with that at all? Do you know? Or
not that I can see, and I would love to have an opportunity to chat with both of them. And I'm sure there are other practitioners who are focusing on this.
Mm-hmm.
But again, what's important here, and I think what you're beginning to really understand now, is the simplicity and the enormity of these minerals, particularly as it relates to our overall health and well-being. And that it's in no way taking away the impact that Dr. Fong or Dr. Ripich are having in their practices, but they can take it down a notch and get into the essence of what are the minerals and what's the mismatch between the minerals that might further enhance the results that they're getting.
How does PUFA, do you think, or magnesium relate to the pancreas health and those enzymes, and copper as well? Do you think they play a role in some way?
Well, they have to. If all of those cells have a bilipid membrane, and so if the construction of the bilipid membrane isn't right, it's not going to function well. Magnesium is absolutely essential in making energy. Energy is spelled magnesium -ATP.
Mm-hmm.
Magnesium is very important for the enzyme functions, as you know. Anytime anyone gets pancreatitis, that the last 4 letters in that word are ITIS. It's the iron seeker.
Mm-hmm.
And there's an absolute once the cells lose copper, they start to take on more iron. That's well established in the pancreatic research, and that's the precursor to pancreatitis. And there's a massive loss of magnesium with pancreatitis. Now, what the endocrinologist will tell you, they'll say, well, the disease came first.
Right.
Right?
Yeah.
That's exactly what they've been taught,
Mm-hmm.
not knowing that these mineral dynamics allowed the conflict between copper and iron to build to the point where there's this massive inflammatory process that causes massive loss of magnesium, which then destabilizes the health of that organ.
So I'm just curious, because I know people that have diabetes type 1, both type 1 and type 2 diabetes, and probably anyone listening or watching has the same experience. Either they have it themselves or they know someone that does. And sure. I'm just so curious, because if you were to, specifically with type 2, because this is much more manageable than type 1, if they were to follow the root cause protocol and start going through some of these ways of chelating, getting rid of excess iron, as well as bringing in copper and magnesium, it seems like you'd be well on your way to restoring some sort of homeostasis, right, within the body to be able to deal with that insulin or that lack of.
Right. And so the challenge for this client that I keep referring to is that he's been taking medications for 20 years now. And so it's having to deal with that side of it, that the root cause protocol, he's adopted that, feels great. He loves it when he goes to donate blood. He says, I can't believe how much better I feel when I donate blood.
Oh, yeah.
And so he's being very dutiful about the protocol, the components of the protocol. What he's now focusing on is working with his doctor to begin to scale back the medications, because he's convinced that his body will be able to handle it. Mm-hmm. And that's the decision point that everyone's going to have to face with their doctor is, the mindset of the conventional physician is, well, you're broken and you're going to need these medications for the rest of your life. Mm. And I think the mindset that you and I have and your followers have is that, no, the body just wasn't fed right. The tissue needs to be rejuvenated. Mm-hmm. And over time, that will happen. And is it going to be a complete reversal? Well, ideally, yes. But certainly what Stefan Rippich has found, that for type 2, yes, they do have a complete reversal. I think Dr. Fung has found that same phenomenon with his experience with his patients. So I think there are some striking examples here where, yes, this is in fact possible. Now what we have to do is manage the chemical assault that's brought into the body by the traditional intervention.
Now, it's interesting because you talked about how antibiotics affect the body's ability to regulate copper, to utilize copper. You talked about ascorbic acid does somewhat the same thing, at least to the enzyme that causes copper to be sort of released, not usable. And then some other things that sort of screws up copper. Now, I'm wondering if someone's on if they're on diabetic medication, do standard medications also throw off the copper's ability to regulate these things, do you think?
Well, I was studying a glib answer would be yes, but let me qualify a little bit.
Okay.
I was reading a fascinating article about schizophrenia, and there's a recognized relationship between high serum copper, high copper in the blood, and that condition. And so this research team was studying that with some discipline. They really wanted to see, is there another way to look at this situation? And so they were really focusing on the level of copper, and it absolutely bore out that there was an elevation of copper in these schizophrenic patients. The ceruloplasmin was elevated. That doesn't mean it was active. The level was high, which is an inflammatory response. But they went one step farther than anyone else had ever done. They said, well, let's look at this iron, or let's look at this copper inside the spinal fluid, and let's study copper inside the brains of patients who've had schizophrenia but have died. No one had ever done that before.
That's interesting.
It's fascinating.
Yeah.
And what they discovered was that the copper in the spinal fluid was perfect.
Okay.
Perfectly normal, exactly where it was supposed to be. And then they went into the research that look at the analysis of minerals in the brains of people with schizophrenia. Perfect copper levels in the brain. And then one of the lead researchers this is in black and white in the article, says it would appear that the antipsychotic medications that we're using is affecting ceruloplasmin and causing copper to rise in the blood. Now, that's a very bold thing for someone to say.
Oh, yeah.
But then it begins to sync up with research that I'm very familiar with around antibiotics, around birth control pills, around hormone replacement therapy, around anti-anxiolytics, all of the benzos. They all blow up copper. And so suddenly we've got this false narrative around high copper in the blood and a disconnect with the copper that's taking place in the central nervous system and inside the brain. and most likely inside the tissue or the organs that are dependent on it.
Hmm.
And so there's been this confusion, and I think that to respond to your observation, I think that there is a correlation between these medications. I'm not going to go down the conspiratorial trail and say it was designed that way. I think it's a byproduct. I think it's an unfortunate byproduct, and people need to understand that there is a price to pay with using these meds. And unfortunately, it's a very heavy price, because one of the reasons why Mildred Seelig, who was a world-renowned magnesium expert, left the world of big pharma, is because she discovered that every drug she was studying caused magnesium loss, and that's a fact. And now we're finding out that many of these classes of drugs are causing copper elevation and disrupting the elegance and the importance of bioavailable copper to activate oxygen and deactivate oxidants. And I think that's a much bigger frame of reference than I had ever imagined. But I think your question is really raising an important set of implications that people need to be aware of.
Yeah, and when you think about the fact that we have so much iron, we can't afford to lose any copper, right? I mean, the copper that we have is probably less than we need, and then we're losing what we already have, and so it becomes this kind of cascading effect, right?
Absolutely becomes a cascading effect. And there are agents in farming, agents in food, agents in big pharma that are very disruptive to copper iron metabolism. And then we just have stress in general. Again, that a body under chronic stress will trigger the liver to make an important protein called metallothionein. And what does metallothionein do? It binds up copper 1,000 times stronger than it binds up zinc. Well, that really alters the metabolic vitality of the body. It loses access to the very metal that's essential for allowing us to metabolize oxygen.
So say that once again, Morley. So stress, just so that because I know, for me, when I listen to podcasts, I listen to radio shows all the time, and someone will say something really fascinating, and then I'm kind of doing dishes or something, and I don't quite, so I have to rewind. So you're saying,
are there dishes there? I don't see you doing dishes.
But you're saying that so somehow stress, it creates this enzyme that binds up copper, right? But then it also screws with it lowers your magnesium too. So it's like a double front thing going on, right?
So when we are under acute stress, in a car accident or blunt hit to our head, there's this massive loss of magnesium and a massive loss of B vitamins to respond to that.
Okay.
If in many situations where people have chronic illness, it's a chronic stress. And the body has this mechanism to trigger, the liver triggers the production of metallothionein under this state of chronic stress. Basically, what the body is saying is, this organism can't seem to survive, so I'm going to begin to shut it down. And it's not being malevolent. It's responding to the signals that it's been trained to respond to. And that protein, metallothionein, will bind up the copper in a very powerful way, and then you've lost access to the very metal that allows you to have true vitality.
That's so interesting. So when it comes to diabetes, then the two main minerals that people want to deal with or actually increase are copper, magnesium, and then lowering iron. That would be the sort of the heart of the root cause protocol, right?
Right. And the other thing that's very important for pancreatic function and for liver function is retinol. I mean, it is an anti-inflammatory agent. It makes copper bioavailable. It enables critical. I just happened to Google it yesterday. That I said ACE in our cells, retinol deficiency. I was like, oh wow. I mean, these cells must have access to retinol. So think of the pancreas as this incredibly important engine for breaking down our food. Well, what do engines need? They all need oil, right?
Mm-hmm.
And what's the oil for the pancreas? It's called retinol. And it again, we've not been trained to think that way because we've been so preoccupied with iron, so preoccupied with calcium, so preoccupied with zinc, and so preoccupied with vitamin D that, wow, we don't have the bandwidth to start thinking about, oh my gosh, I need magnesium and copper and retinol. It's like, and that's really that's the whole basis of the protocol.
So copper, in order for it to be bioavailable and usable, needs retinol. And where do people mostly get retinol?
Don't get it from a supplement bottle, please.
Okay.
The best forms of, and I call it real vitamin A, and it comes from fat.
Uh-huh.
And fat stands for from animal tissue. No offense to the vegetarians and the vegans in the crowd, but that's, we live in a very challenging world now. But the grass-fed beef liver is a very important, it's probably the richest source of retinol that we can access. I've got 25 vegan clients taking desiccated liver tablets. That's how desperate they are to feel better. We've got cod liver oil. And again, cod liver oil comes in many varieties.
Mm-hmm.
The only two that I really recommend are Rosita's and the Alaskan cod liver oil that Jigsaw sells. Please be very mindful of what I just said. There are only two that I recommend. Mm-hmm. And butter. And what people need to understand about butter is not all butters are the same. We know there's a difference between grass-fed and grain-fed. That's a no-brainer. Right. We know that's different. Well, grass-fed comes in gradations. You can get grass-fed that only has 12% butterfat. Dr. Liz, my wife, and I were up in Amish country several months ago, and we got introduced to Amish butter, which has 86% butterfat. Very different, much richer, more robust. Mm-hmm. Now, here's something that I didn't know that I think your listeners are going to find fascinating. These fats come in different lengths, and the length of a fat is determined by how many carbons it has inside it. Okay. And they start with C3, and I think they go all the way up into the C30s. But there's a very important section called C3 through C8, and C4 is butterfat. But the enzyme that breaks down those C3 through C8 fats, it's about this long. The name of it, ridiculously long. And guess what? It's copper dependent.
Really?
So you can't break down butter if you don't have copper in order to break down the butterfat. And so butter is a very rich source of retinol if it's grass-fed, okay, and if it's really very well cared for. Heavy cream. Another very, what's fascinating, one of the things that we did years ago was we bought a cookbook. It's called the Vandy Farmer's Cookbook. It was published back in the 1800s in Boston, early 1800s. And the recipes, Justin, were amazing. All this heavy cream and lard and butter. And I mean, there were foods in there that I'd never heard of.
Yeah.
But our ancestors thrived on these fats. And the soils were very different back then, as you can well imagine. Mm-hmm. And so they had a completely different diet that they wouldn't recognize the food that we eat today. They would be.
Whoops, Morley, are you there? I think we lost you, my friend. Oh my goodness. Well, if you guys are watching, hopefully we'll reconnect with Morley Robbins. he was just talking about the butterfat and the Amish 86% butterfat that's in that. Interesting topic so far, right? I hope you guys are enjoying the show, and we kind of are going through a list of, if you're kind of joining us new, it's my contention that Morley Robbins' work is so vital for us to understand what real health is, and for us to understand what's really going on from a mineral perspective and how iron affects just about every metabolic process in the body. So we're talking about the root cause protocol as it sort of aligns and goes along with different health challenges. And what we're going to do is we're going to invite Morley inside the Extreme Health Academy and go really deep on some of these topics. And I think that with a slideshow presentation and an understanding fully what minerals do inside the body, I think it's going to be really, really great to have this foundation for how these things affect disease process and how healthy we are and how much energy we have and what our hormones are like and our sex drive and our ability to go to the bathroom and sleep and have energy and these types of things. It's so important to make sure that iron is regulated, and then also there's enough bioavailable copper. And this is something I've been studying so intensely over the past few months, actually, since we had Morley on the first time. And this is, I think, the third or fourth episode we've done with Morley Robbins. So I hope you're enjoying the show so far. It is episode 643. So I don't know if we're still streaming. Are we still streaming? It says we're still streaming. Yeah, I think we are. So yeah, I'm looking at you guys on YouTube, and what I wanted to do was I wanted to tackle one more issue, and that was Alzheimer's disease, because dementia and Alzheimer's and these cognitive neurological diseases that we're facing in our time are just, it's a result of living in a modern culture, and it has so much to do with the work that he does in the root cause protocol. So what we're going to do is hopefully Morley will come back to us, because it looks like he sort of went away for a little bit. So we'll try to get him back. And if not, maybe us in the chat room can sort of muse and talk a little bit about what Morley was talking about there with regards to diabetes and the pancreas and things like that. So we're going to be right back. And right after this break, we'll take some questions and talk a little bit more about what Morley said. And if he comes back, hopefully he does, that would be great. If not, we'll just end the show. But we'll be right back right after this.
We hope you're enjoying this episode. Thanks for being on this health journey with us. And don't forget to check out biochargeme.com for hundreds of health products to build a better you.
Yeah, we really appreciate your support, my friends, on biocharge.me. And we put together a little list of products that are available on Black Friday. So if you guys are watching on YouTube, there should be a link down in the description below. I'll be updating that description as well. I didn't have a chance. We had some major technical issues before the show. So I'll be updating that after, so that you guys can check in the description on YouTube or at biocharge.me. And this is where we put all of the products that we use and that we stand behind on. And when you guys support us there, it supports the work that we do, and it allows us to continue doing this type of work. So we really, really appreciate you thinking about us before you make a purchase of anything. And that way, we can continue our work and do all the things that we're doing. And so one of the things I wanted to share with you was, do you guys have a puppy? We have two little puppy dogs. We love them so much. Charlie Brown and Cocoa Puff is what we call them. And we've been feeding them the BARF diet. Now, it sounds gross, but it's called the biologically appropriate raw food, or biologically adaptable raw food diet. I forget exactly what it means, but it's basically raw meat for animals, but what it does is it has the muscle meat, the bones, and the internal organs. So it's super balanced for an animal and what they would eat normally in the wild if they were hunting animals. So listen to what Robert Mueller has to say about this. Did you know that conventional dog food contains antibiotics, herbicides, pesticides, ground up carcasses from roadkill subjected to high heat processing, artificial colors, chemical preservatives, way too many carbohydrates, genetically modified corn syrups, indigestible grains, and a lack of moisture content in the dry kibble? Obviously, this can lead to health conditions like diabetes, itchy skin, teeth and gum problems, liver damage, obesity, behavioral issues, pancreatic problems, and even cancer. That's why we recommend the BARF diet, which is the biologically appropriate raw food diet from BARF World. Their unprocessed raw meats contain bone, organ meats, vitamins, and minerals that are loaded with enzymes. BARF World founder Robert Mueller explains more.
Sure, I don't have to convince you on the damage that's caused by high heat to food. So as a result, we see many skin disorders, a lot of arthritis, obesity, heart disease, cancers. I mean, it's just rampant. The vet clinics are just full of these conditions. And basically a large percentage of the commercial pet food that's made up of the human industry leftovers. And the pet food industry makes use of this waste product. And in addition to that, we are subjected to the products coming out of the rendering plants. Garbage in, garbage out. If you feed garbage to your dog, you're going to end up with garbage health. And if you put the right gas in, your engine runs smoother and lasts longer. So if you put the right fuel in the tank, you're going to get the right output. Garbage in, garbage out.
We've seen an immense difference with our dog Maggie being on this diet. Give your dog the gift of health today by going to extremehealthradio.com/barf or go to our store. That's extremehealthradio.com/barf to learn even more.
Yeah, my friends, if you have a little pup, I would highly encourage you to feed them well, let them experience what a true abundant health is and a long life and being active and full of energy and happy to see you when they're 13, 14, 15 and beyond. And one of the ways that you can do that is feeding them a really, really clean diet. And this is what the BARF World is. So if you have a dog, consider getting them some of this food. And I think they will love you for it and they will be happy. Ours loved our, when we transitioned them over to the BARF diet, they just loved it. Charlie and Coco, they just loved it. So did Maggie as well. So consider getting some BARF World raw dog food. That is available at extremehealthradio.com/643, which is today's show, and or biocharge.me, or if you're watching on YouTube, there should be a link down below for that as well. And something else I wanted to tell you guys about too was a way we talk a lot about stress in today's show and how stress affects copper. And I didn't know that, what Morley was talking about, stress lowering copper levels, but we knew it lowers magnesium levels tremendously. And so a really great way to lower stress is through meditation or Qigong. Qigong is like a moving meditation. And I've found that this is a really powerful practice to do. I like to do it on sunrise. So you're out on the grass or on the dirt doing Qigong when the sun is rising, and then you're getting all the beneficial effects of the biophotons from the sun while you're doing Qigong, which is a moving meditation. Listen to what Dr. Christopher Shade has to say about moving meditation.
People come to me and they're really sick and they got this blown out neurological system and all this toxicity, and I tell them, you need to do Qigong, Tai Chi. You need to do these things that settle down and restore your neurology, because it puts together all the parts. It puts you back into that state where you can start to detoxify. And so I highly, highly recommend all that.
Yeah, Qigong is one of the best things that you can incorporate into your life. And there's a 10-minute session before you go to bed, and then when you first wake up. It's just awesome. Listen to what Kit Campbell has to say.
Qigong is amazing. And the reason that I believe it to be amazing is everything here is energy. That is a scientific fact, if there ever is one. So when you're practicing Qigong, you're actually drawing energy into your body. Your intention, whatever your intention is behind any action, will determine the level of energy, type of energy that you absorb into your body. So your intention behind is very important, just like thought. So when you're practicing Qigong, you're actually bringing energy in and you're bringing out the stuff that might be a bit stale. With Tai Chi, it's totally different. The energy runs underneath the skin because it's more of a martial. This is the Chinese understanding, by the way. It's more of a martial art. So Qigong is very, very good for bringing that energy into the body, and just fantastic.
Mm-hmm. Yeah, Qigong is just such a great tool to bring into your life to lower stress, to build your energy throughout the day, to protect your energy. I mean, how many times do you guys know someone, it's like you have a child or you have coworkers or a boss, a child that's crying, or maybe a boss that's really riding you to do something, or a spouse that's trying to pick a fight with you. And there's all these like external stressors, right? And so it's really nice to have a practice that sort of protects you and allows you to ground yourself and to not let these things affect you as much. And Qigong is really cool. 10 minutes in the morning, 10 minutes in the evening. We all have 10 minutes. And this is a really great, this is why it's a longevity exercise. This is why people in Oriental cultures have been doing this for thousands of years. So it's really, really a great exercise. And if you guys are interested in checking this out, taught by two guests on the show formerly, Tristan Truscott and Peter Ragnar, it's available on biocharge.me. And you can learn more about it and how it all works and how to incorporate it into your daily life and all that good stuff. So make sure to check those out, and we'll be right back.
Extreme Health Radio is your #1 resource for cutting-edge biohacks, news, and information about how to upgrade every area of your health. Subscribe to our newsletter so you don't miss a thing.
Yeah, my friends, with all the censorship going on, it would be really great if you joined our newsletter. If you go to extremehealthradio.com, there's all kinds of places where you can join and stay up to date with all of our shows. So we give you guys, access of different things that's going on. Like, if there's, some sales coming up, or if there's some discounts like Black Friday or upcoming shows or past shows, it's really a cool place. We send emails out on Mondays and Thursdays. So if you want to join and get access to that so you don't miss any of the shows, I highly recommend it. So that way you can stay up to date with everything we have going on. And God forbid, fingers crossed, knock on wood, they don't take that away from us. So I'm seeing so much censorship going on in the world today. So, gosh, I just don't know. I guess the best thing to do is to join someone's newsletter. So in case they get kicked off of Facebook or YouTube or any platform like that, there's places for that. So it looks like Morley, I don't know what happened, but somehow he's gone and he hasn't come back yet. So I don't know what happened. Maybe there was a storm where he was located, because we were going to get into, we basically tackled pregnancy and diabetes, but what we're going to get into is Alzheimer's. And some other things I wanted to get into with him as well is cancer, heart disease, and osteoporosis. And so what I find really fascinating is like this idea of minerals and understanding, like, can health be this simple? Like, is it possible? Because, we learn about autoimmune diseases. We learn about vitamin D and how important that is. And we learn about MTHFR and the inability for us to methylate. And then we learn about glyphosate and toxins and poisons and enzymes and all these sort of complex systems that are going on with our health. And is it possible that we're looking at this incorrectly? We're not looking at it in the correct way, and that is, are these substances affecting us, or are these environmental factors affecting us because we're in an iron toxic environment? And so when you get your iron levels regulated, and then you start increasing your copper and increasing your vitamin A, your retinol, so that your copper can work and be bioavailable inside your body, and you increase your magnesium and lower iron, and then you start understanding, like, wow, so now my body's fully functional. Now I can, make vitamin D from the sun because I have enough cholesterol and vitamin A to work with that. So it's fascinating. One of the things I find really interesting about his protocol is, like, he's not a big fan of vitamin D, taking it supplementally. He's not a big fan of taking zinc because of what it does, along with vitamin C. So that's really interesting too, because you hear in the health community, we did a show with Dr. Andrew Saul some time ago, and he's the vitamin guy, right? He's the high dose vitamin guy. And he talked about, I asked him point blank if there's any difference between vitamin C and, ascorbic acid and whole food vitamin C. And he said no. He said no, it has the same effect, specifically with the metabolic processes that it affects in the body. And so it's interesting in that way. But then Morley talks about this whole food vitamin C complex. And there's an enzyme, apparently, that it affects. So if you're taking, the reason why Morley's not a big fan of taking ascorbic acid is because as you probably know from this show, we need all the bioavailable copper that we can get, right? So in order to manage this massive amount of iron that's causing disease, so we need that copper. And apparently, according to Morley, this destroys some enzyme. I forget what it's called. He has all these fancy names. I don't remember what all the names are. But it destroys an enzyme, and it causes copper inside the enzyme to be, or inside the cell to be sort of like diarrhea. So it makes it not bioavailable. It just ruins the copper's ability to work its magic in the body. So that's interesting. But whole food complex doesn't do that. So because it has all the cofactors and all the different, what do they call that? Cofactors and antioxidants and other constituents in the plant that prevent it from causing the cell to leak copper, which we need in order to regulate all that iron. So I've gotten into blood donations. So something that I'm doing is I already have started donating blood. So Morley recommends, according to the root cause protocol, 4 times a year for a man. So I figured the best way to remember that is to do it during the change of seasons. So I do it now on like the 22nd of, December. That's going to be the first day of winter, December 22nd. And then I did it in September, at the beginning of the fall, September 22nd. And so anytime the season changes, right around there, give or take a few days, depending on where they're located, I'll do a donation to get rid of some of this excess iron inside my body. And so I think that Morley's content is so foundational and so important. And I listen now to different podcasts. I'm a podcast junkie, and I listen to so many different podcasts. And I think that having a new framework or new paradigm or worldview through which, and a lens to see what's going on in the alternative health community. Now when anyone talks about copper or iron or magnesium, my ears perk up. And understanding that a lot of these things people are talking about are going into a body that's not healthy, that has iron overload. And so it really starts to make sense because, like I said at the end of the break, like, is it really this simple? Is it really like 4 minerals in 1 vitamin? Copper, iron, magnesium, calcium, and, retinol, vitamin A. Like, is it really, really that simple? And I think it is. And I think that sort of should be the foundation of our health. Obviously, there's other things too that are really foundational, right? Protecting our mitochondria from blue light is huge. Protecting us from EMF is huge. But here's the thing that I'm kind of coming to now recently is, how does EMF affect a person who has iron overload versus a person whose iron levels are regulated with enough copper and enough magnesium? So would EMF affect, because Magnetico, talks about dirty electricity in the walls, this stray voltage, and these things have shown in her work to alter blood sugar levels. So what I'm starting to wonder now is, like, it's the age-old idea of become as healthy as you possibly can, and all of these environmental stresses, although yes, bad, and yes, we can mitigate them, and we should work on mitigating them, huge, huge, huge. I'm just wondering if we ourselves are regulated from a mineral perspective, how much these environmental toxins can really affect us. And let's say they can and do affect us, they would probably affect us a lot less, in my opinion, because our body's much more healthy. So if you have a sick and toxic person who's filled with inflammation, who's filled with way too much iron, not able to turn oxygen into energy and into water, can't make ATP, and then exposing that person to EMF and dirty electricity in the walls, it's a whole different story than exposing someone who's really balanced. And so I think this is why I'm going to have Morley on a monthly basis. I think his work is so important, and it's crazy because I listen to a lot of people who just don't understand the types of things he's talking about. I listen to a lot of really smart people, and this is how we find guests for our shows, because I'm a constant consumer of podcasts. I listen to them all day long while I'm working out, while I'm outside on my rebounder, while I'm in front of my red light, while I'm in the sauna. I'm constantly listening to podcasts because I think in order for me to sharpen my interview skills and to be able to understand more, it helps me to learn more and to be able to better serve you guys. But I think it's just an an incessant desire for knowledge because I really do want to help people. Like when we're talking about diabetes, I have a certain person in mind who's dealing with type 1 diabetes. And it's one of those things that I want to shout from the rooftops, and I want people to know that there's solutions out there that could and probably would work outside of the conventional system. And so I don't know about you guys, but I see a real danger with the medical system and the medical model and how it sucks people into itself, basically, and cannibalizes people for profit. And it's really disturbing. It really is disturbing. And I hate seeing friends and family suffer. Like it says in the old good book, my people perish for a lack of knowledge. And it's so true, right? If I could just tell people. I know so many people that have succumbed to diseases that they may have been able to overcome had they understood some of these basic foundational principles. And it used to make me angry that we're not really taught them. You know, it used to upset me that like we're not taught these things in school. But then I realized, you know, we're all here for a reason, and we're all under our own responsibility to take the time to learn. And I realize that learning about minerals for the average person, for me, it's fascinating and fun because I can help impact someone's life. I can help them not experience symptoms of a disease, right? Or myself, you can prevent stuff. But I realize it's not that fun for people to intellectually understand how copper depletes or our iron depletes copper, and copper is needed to regulate iron, and how all these diseases are tied to that. But if you all of a sudden have a disease, you know, then all of a sudden you become interested, right? And so I don't know, maybe it is for me. I don't know, maybe you guys know more. Like, why do you listen to podcasts? Because you want to prevent disease or overcome something, or you want to help somebody else? For me, it's kind of all of the above. You know, I want to help as many people as I possibly can, because not only are people suffering for lack of knowledge, or perishing for lack of knowledge, we're suffering for lack of knowledge too. You know, and it's really, really sad. And I know people in my own life who are having these health conditions, and they don't ask me any questions. And so I let everyone have their journey. I'm here if people want to ask me my opinion, and you know. And this is why I think subconsciously I love the Extreme Health Academy, is because I get to answer questions and help people in the forums with all of these types of topics. And in my real life, nobody asks me anything, you know, no one asks me stuff. And I'm sure you're the same way, right? You have friends and family suffering, and they know that you're into health, but you just, you know, they just kind of do their thing, and they take the medications, and, you know, that's all there is to it. And they don't really bother to seek your advice. And this is why I'm sort of addicted to spending time in the forums inside the academies, because it's filled with people who want to know. It's filled with people who are interested in trying new things and overcoming, you know, their health challenges, because it's so easy to take a pill, right? It's so easy just to take some pharmaceutical medication, not understanding what it does to your copper levels, for example, or your gut flora or your liver. And so for me, I just hate seeing people suffer needlessly. But I've gotten really good. I don't know about you guys. Have you guys gotten good at being able to let people have their own journey? I'll have people suffering in front of my eyes, and I don't say anything because they didn't ask. And, you know, it's like the old quote by David Wolfe. Is it David Wolfe? He probably stole it from somewhere, but he said, the only disease is a closed mind. And it's true, right? So with Google, in the age of information, ignorance is a choice, right? If people know that you're into alternative solutions and they don't seek you out, well, that's sort of on them. So all we can do is present information and let people know that we're into certain things. And if they want to chime in and ask us, then more than happy to help people out who want to help themselves. So I apologize for Morley being cut off there. I don't know what exactly happened, but I'm curious if you guys have any questions in the chat room. Bob Dylan, it's always great to see you, man. It's cool to see you. I love seeing when you're here. Consumer Revolution, you're a great interviewer, Justin. I don't know about that. I do my best. I always feel like I stumble and fall short on the interview side, but I do my best to ask questions and try to steer the guests in a way that is good for everyone. It's challenging because I have a million questions, but sometimes those questions aren't really relevant to the most amount of people. So I have to kind of make sure I stay on point and bring out ideas from the person that maybe they've never shared before, or ideas that they're really passionate about, all while trying to balance what people want to hear and then not having them just go on and on and on and on with that, and having it be a monologue instead of a dialogue. So it's I do my best. I try hard. I have stage 4 restless syndrome. Doctors say I have less than 100 years. Yeah, that's funny. Only 100 years left to live, huh? Nova Doll, good to see you here as well. That's awesome. Why are the comments turned off after the show is done? Yeah, so I've turned the comments off. Not the comments, but I've turned the comments off below, but not the chat. So actually, in this one, there may be comments. I forget to turn that off. Let's see. Restless leg syndrome. That's so funny. You guys are awesome. Bob Dylan, you're cool. Patrick D had a question above. What was your question, Patrick? Did you write it in all caps? Gloria Givas says, I thought simple sugars are okay for our bodies, but not processed sugars. Yeah, there's a whole big debate about sugar and what it does, glycogen stored in the liver and what it does. Some people say it's the devil. Some people say it's what our bodies run on. And so I think what it comes down to is the oxidation of iron, polyunsaturated fatty acids, and stress, and how well your liver works to be able to store that glycogen and to be able to use it for energy. And so it all depends on, where you are in your health journey to sort of see how much sugar you can get away with. So Bob Dylan says, what do I have to do to get pregnant? I really want a baby. Oh, sorry. I was listening to the beginning of the podcast. Well, yeah, listen to the beginning of the podcast, Bob, and look into what he was saying about that. It all comes down to a lack of bioavailable copper. Givas, I thought there was no. Let's see. Let me go back up a little bit. I'm trying to find What about fruit consumption? What types of sugars are those? Yeah, for me, fruit sugar is definitely okay. I try to eat seasonally and locally and obviously organic, because there is an issue with fruit that's coming in from different parts of the world being consumed, at times of the year that wouldn't make sense for us from a biological perspective. And what that means is basically, like Dr. Jack Kruse says, don't eat a banana in New York in the middle of winter, because that fruit is capturing biophotons from the sun, and it turns out that we have photoreceptors in our gut. And so when you get this circadian mismatch going on, the body's unable to understand what environment you're in. And so if you eat food that's capturing photons in the exact environment you're in, it's going to help your gut understand and recognize what that food is. So it's really important to make sure that you're eating locally, if at all possible, obviously organic, so that the photoreceptors in your gut are going to capture the biophotons of a local food, so that you're not living in, say, Alaska or northern Canada and eating food from the tropics. That wouldn't make any sense. And so according to Dr. Kruse, that would create what they call circadian mismatches. And so that's just inability for your body to sort of understand its environment through the photoreceptors that are in your gut. And so that's an issue. So eating locally, eating organic, obviously fresh is a big deal too. So trying to follow all those things, and eating with the time of day. Obviously, that gets into the Adam Bergstrom information about chronobiotic or solar nutrition. So that concept is more about eating fruits and food that captures the first rays of the sun. So those are foods that would be higher up off the ground. And so those biophotons that hit the fruit, it all goes into the angle at which the sun hits the fruit. And so fruits would be eaten earlier in the morning, and then foods that are closer to the ground would be eaten midday or in the evening. And then like fish or tubers or roots, those would be the last things to get the sun, and those would be consumed in the evening. So like eggs or carrots or fish, these are evening foods according to chronobiotic nutrition. So when you start following the principles of nature, it really starts affecting your flora and your energy and things like that. So there's a lot of different principles to use with diet. So Bob Dylan says, whoa, Age has not been kind to Sylvie. Yeah, so the last show we did was Sylvie Beljanski about cancer, and I forgot to put a new thumbnail up for Morley Robbins, which I'll do after this. Good one, Bob. We need vitamin D, though. It's a known deficiency around the world, Cheryl says. Yes, vitamin D is deficient, but in order to create that, you need a liver that works properly, that's not full of iron and polyunsaturated fatty acids. And then you need cholesterol to be able to interact with the sun, with the biophotons from the sun in your skin, to be able to create that vitamin D. And so if you don't have that, then taking a vitamin D is going to dysregulate calcium, which is going to cause fibrosis and calcification of your arteries. And this is why what's his name? Morley Robbins isn't a big fan of taking vitamin D supplementally. We should be getting it from the sun. So assuming our livers are working right, assuming we have enough cholesterol and retinol and vitamin A, and we're getting adequate sunshine during the day, then we should be able to make vitamin D enough in our skin, and rather than supplement it, because it is a hormone. Right? So you don't want to be supplementing these hormones that are going to be affecting and throwing off calcification and calcium levels, because then you got to worry about things like plaque in the arteries, right? And when cholesterol gets oxidized, then from polyunsaturated fats or iron overload and stress, then you start having cholesterol in the arteries, and then, less than great things can happen there. So, Jivas, this is a bunch of info I'm going to have to listen to 2 or 3 times more. Yeah, he's cool. I really like Morley Robbins. I think that he's one of the seminal people. Like I mentioned before, he's so important, and he's just not getting enough play in the internet. He's really not getting the amount of time that he should be to share his ideas. So I'm really a big fan. I'm going to start bringing him on once a month to talk about some of these things, because like I said before, they're so foundational, but everyone's chasing all these other things that I think that could be fixed with the work that he's talking about. So Hannah says, I've definitely been interested in Morley's work for some time now. Thanks so much for doing this interview. Yeah, no worries, Hannah. We've had him on 2 or 3 times before, so we've got a little bit of a foundation work that we've done with him. So yeah, check out our previous interviews with Morley, if you would. Happy Thanksgiving, everyone. Chris says, get an extra helping of copper. Nice. Yeah, I hope you guys are going to have a great Thanksgiving if you're in the United States, and going to enjoy yourself. Here's a little Thanksgiving tip, all right? A little tip from me to you, and that might help you sort of go into Thanksgiving with a little bit of ease and grace. Be kind to yourself, There's a lot of food that's served during Thanksgiving that is less than the best for you and not very good. Just, if you eat it, just eat it with gratitude and eat it with compassion for yourself and love. And don't worry too much about eating one bad meal, if it is bad. So, just forgive yourself, get your regular blood donations. Take your beef liver capsules, which, by the way, I wanted to tell you guys, he talked a lot about beef liver. And if you're like me, beef liver is not the most tasty food in the world. So on our store, biocharge.me, we have the Ancestral supplements beef liver. And we also have a lot of organ meats that are in capsule form. And you can look more in the animal section on biocharge.me and look at all the different supplements that are there of organ meats that we've been deprived of, because they do have iron, but they also do have copper. And this is really important food to make sure we get in our diet is enough organ meats. And so if you want to start that journey of getting into eating organ meats, a great way to do it, especially if you're traveling too, our capsules and the Ancestral supplements are there in our store. And if you purchase anything from our store, we'll give you a 30-day trial to the Extreme Health Academy, where we go deep into this kind of information even further. Jiva says, I pray for people Gloria says, even when I try to tell them there is another way out of their suffering, but they won't listen. So this is a real issue, right? This is a real issue with people, and I face it too. You have people in your life that just don't want to know. My wife, Kate, was telling me of her uncle is having some real issues with his health right now. He has, I think, his body has pancreatic cancer. His blood sugar levels are 200 plus. his body's deteriorating. He's urinating blood, and he consumes just alcohol through the roof. And, he has no interest or desire to change his life. And he's not doing anything for any of his health challenges. And this is what happens when people just want to live their journey. And we all get to be, make decisions for ourselves, right? We all get to do that. And for me to deprive someone that I love of being able to make the decisions that they want to make, it's not my place to do that. And so it's there's a delicate balance of being that sort of Nazi person that you tell people they have to change their diet if they want to overcome XYZ, or just being there as a loving support and supporting someone no matter what decisions they make and having compassion on them. Because I've seen a lot of people go through cancer and they choose chemotherapy and radiation, and they choose these treatments that are further destroying all these levels in their body and their immune system as well. But the only thing for me that I feel that I have to make it known, that I want them to know that I have or I'm into alternative answers. And as long as they know that, then it's their responsibility to reach out to me. And if they don't do that, then I'm just going to be lovingly support them through whatever the process is in their life. So, Chris says, does anyone know, is beef liver or goose liver better? Ooh, good question. Goose liver. Never really considered that. I don't know. What do you guys think? Is goose liver better than beef liver? I wouldn't think so, because they would offer it, on Ancestral supplements, or it would be a known thing, right? But maybe it is. I don't know. Never really considered it. I just go for the beef liver. And if you go on to biocharge.me, we have capsules of all kinds of stuff. We've got the beef liver, we've got pancreas, we've got brain and lungs and all kinds of stuff encapsulated on Ancestral supplements. So those are all available on biocharge.me. Where can we find episode on PUFA, polyunsaturated fatty acids from Big Fat Mama? We've done a number of shows with, Professor Brian Peskin. He talked about the dangers of fish oil. So if you go into the archive section of our site, you'll see ones from Brian Peskin on polyunsaturated fatty acids. We've got a couple with Adam Bergstrom. He's written like 9 books on polyunsaturated fatty acids. Isn't that crazy? Like 9 books. Like how do you write so much information about one thing like polyunsaturated fatty acids? It's crazy. So we've done a number of shows with him, and then we did one with Matt Blackburn. I don't think we talked too much about PUFA in that one, though. But if you go through our archives, there's quite a bit of shows about that and what it does and how it suffocates the cells of oxygen and basically chokes the cell. So it's a lot like iron oxidation. These oxidized lipids causing so many of the diseases of our modern day, and just people don't know, and it's part of our work is to help people know about these things. Gloria says, wow, this is awesome info. Glad you explained the fruit thing so well. Oh yeah, you're so welcome, Gloria. Yeah, it's it just, it's a more scientific approach, because like we all hear people, and it's mainly like the hippies, right, with the dreadlocks and walking around barefoot, and all these types of people talking about how we should eat locally, we should eat in season, and we know it kind of makes sense, but sometimes it's good to have a little scientific background as to why that happens, or why we should be doing that. Because the hippie approach, although cool and fun, sometimes you seek a real explanation. And the idea that we have photoreceptors in our gut is pretty interesting to me. Like why is light a part of digestion? Like that's really, really fascinating to me. And so when you think of food as being a repository of light, because food is just captured biophotons, it's captured sun energy. And so when you consume that in the area that you're living in, it just makes sense. It's what our ancestors did. It's what all indigenous people did around the world. They weren't living in, say, Egypt and eating food from Alaska. They just weren't doing that. So every creature eats locally. Every creature eats organically, obviously, except for humans, because we're able to ship food all around the world. So this is just one of the things when human beings feel like we can alter the cycle of life, right, and circadian rhythms. We feel like we can control that a little bit through living indoors, living in houses, being able to travel around the world wherever we want, being able to get food shipped to us from around the world in seasons that don't match our current environment. This is what happens. And so the further we do that, the more disconnected from the cycles of life in nature we become. And when that happens, then real issues start to happen with our health. And it's just like a slow progression, a slow breakdown. And we wonder why we're sick. It's because we're further disconnected from nature. And the more connected we can get to nature, the better, and to ourselves and to other people, the more vibrant health we can explore and have. So I hope you guys enjoyed that. It's a real bummer that Morley got cut off there. That was so weird. I'm not sure exactly why that happened. And I thought he would come back, but maybe he just had some internet problems there. So this was episode 643. So I'll try to put links to everything that we talked about at extremehealthradio.com/643. And we've been going for about 2 hours. In case you guys have any other questions, let me know, or I can take off now. Darren, good to see you here, my friend. I see you on Instagram, or I see you on Facebook, and I'll lay off the eggnog. That's great. Yeah, thanks, Darren, for being here. I appreciate that. That's awesome. How do you get copper in your body? So Gloria asks, how to get copper. So avoid ascorbic acid, avoid pharmaceutical medications, specifically antibiotics. That's 2 ways. Eat organic food because the soil is going to have more copper in it than traditional food. So there's like 3 things you can do that, don't take much work at all. And then organ meats are going to be high in copper. And the 3 foods that, according to Morley, are the highest in copper are whole food vitamin C. That's not ascorbic acid. That's plant-based whole food vitamin C. What's the other one? The other one is beef liver, which we talked about. You can get on biocharge.me. That's another way to get copper. And what's the third one? There's something else that's very high in copper. Whole food vitamin C, beef liver. I forget what the other one is. I forget. It'll come to me in just a second. Yeah, there's something else that he recommends that are high in vitamin C that I was just reading the root cause protocol the other day, and I forget what it was. See, when you forget, that's a lack of magnesium. So magnesium, or memories, from what I understand now, are responses and electrical charges that take place in the hippocampus. And it's your body's ability to have enough magnesium to open up the file drawers to be able to release those memories in the hippocampus so that you can remember them. And so it's magnesium that's directly responsible. I always thought it was ginkgo biloba, but it's apparently magnesium. So maybe I'm magnesium deficient today. Well, I know I am. Everyone's magnesium deficient. So make sure to get enough copper in your diet, guys. And Oscar says colloidal copper. There you go. Sesame seeds are, but it is the wrong form of copper according to Morley. Cod liver. Yeah. What's the other one? Morley talks about it. Root cause protocol. I totally forgot what the third form of copper is. Can you guys know? Let me do rcp123.org. And let me see if on the root cause protocol he has it there with copper. So if you go there, it's really interesting. I'll bring it up here on the show if you guys are interested here. If you go there, he has a series of stops and starts. So stop taking iron supplements, stop taking vitamin D3, stop taking calcium, zinc, molybdenum, multivitamins, prenatals, ascorbic acid, obviously high fructose corn syrup. That's right, because that screws up copper regulation as well. Omega-6 oil and fluoride. Yeah, that's the other one. Whole food cod liver oil. Let's see, vitamin E complex. Oh, that's cool. Taking a whole food vitamin E complex. Matt Blackburn has his MitoLife products, a vitamin E complex, in our store under MitoLife. Magnesium, cod liver oil. Okay, phase 2. Oh, bee pollen. That was the other one. Yeah, beef liver, bee pollen, rice bran, stabilized rice bran. So there you go. donating blood, getting more sunlight, blue light exposure. Yeah, so that's part of the root cause protocol. Not beef liver, bee pollen. I always forget that one. I don't know why. I always forget bee pollen. So that was a good show. I hope you enjoyed it. Share it with your friends. If you know of anybody that is dealing with either diabetes, we tackled that after the first break, around 35 minutes in, I'd say. And then the first half of the show, we talked about pregnancy. So if you know of anybody that's dealing with any of those two issues, make sure to send this to them, and hopefully they'll take a liking to it and listen to it and maybe get pregnant. That would be pretty cool. Gloria says beef liver can be more tasty by soaking it in milk for about 30 minutes, then rinse it, then soak it on 1 tablespoon of vinegar for 3 minutes, then cook it with a lot of sliced onions. Do not overcook. That's really interesting. Okay. Soaking it in milk for 30 minutes, then you rinse it, then you soak it on 1 tablespoon of vinegar for 3 minutes, and then cook it with a lot of sliced onions, and do not overcook. Cool. Thank you for that. That's great. How does it taste when you do that? Does it taste is it palatable, or does it actually taste good, I wonder? That's an interesting recipe. Really appreciate your program, Angie says. Great guests and chatters, but you bring a ton yourself. I may need to hear things more than twice, but I am learning. Thank you. Yeah, Angie, thank you for this. I picked up a couple things from listening to health radio shows over the years and doing over 650 shows ourselves. So, pick up things here and there and try to present them in a way that's digestible and people can understand. I think that there's a lot of people out there that feel like they have all the answers, and even, as foundational as Morley's approach is, it's just a slice of the pie. But it could be one slice that moves the needle more than, any other slice of the pie. So it's really important to have a foundation upon which to live your life and principles to apply. So for me, the foundation these days is looking like pure water, bathing in and drinking, increasing my magnesium, increasing my copper, decreasing iron by blood donations, managing my light environment, and trying to go to bed early and get lots of good sleep, reducing stress, increasing my amount of animal fats and animal foods right now, and connecting with others and being happy and exercising and breathing right. There's a lot of foundation things you can kind of just incorporate into your life. Like, it's really easy to block light. That's the foundational piece, in my opinion. That's why I'm wearing these blue blocking glasses. We carry these in our store, biocharge.me, and managing our light environment. You can see here my light environment right now is pretty red. So light environment is huge. EMF protection is huge. Making sure you get enough water that's mineralized water. Making sure I'm getting enough retinol and animal fats, and making sure I'm getting enough vitamin C in whole food form, and copper and magnesium, and lowering iron, sleeping, lowering stress. Making sure I have enough sort of sugar, not too much sugar, but finding that sugar balance for myself right now. Exercising, being happy, connecting with others. It's pretty simple, right? I mean, it doesn't take that much really work, you know what I mean? Taking some enzymes, making sure you digest your food, pretty simple stuff. I've kind of gotten off the supplements more. I don't really consider bee pollen to be a supplement. I consider it more to be a food. I don't really consider beef liver, even if you take it capsulated, desiccated in capsule form, I don't consider that to be a supplement because it's a whole food. So in that regard, I've lowered my supplements like a lot. You don't really need a lot. You really just need to focus on copper and magnesium, really. And then making sure your iron, making sure you read the labels of the food you eat so that it doesn't have too much iron. So it's really kind of foundational when you start thinking about all this stuff, because you can get really complex. And, if you're dealing with a chronic health issue, I can see where, you might have to do some things that are more complex, but and then on top of that, I like to do my little rituals, like the Juve. I do my red light therapy every day. I do my sauna. I do my rebounder. I do my magnetic mattress, or sleep on the magnetic mattress, but I also get pulsed magnets from my IMRS product, and these types of things I do every day, and the Qigong and things. And so I like to do some things every day that help restore health. But, to be honest, I get the most benefit from hanging out with friends and just laughing and having a good time and enjoying myself. So Bob Dylan says, bee pollen will put lead in your pencil. Oh, man. I really appreciate your program. Great. Oh, yeah. That's an interesting recipe, Gloria. Thanks for sharing that with the beef liver. All right. Well, if you guys want to support our work, I would appreciate it if you would go to our store, biocharge.me, and you can learn more about our Black Friday and some of the things that we have there, some products that might help you. And, I think you might be able to enjoy some of those products. So we appreciate your support on there a lot. That's really, really helpful. And if you do that, we'll give you a bonus as well for supporting the work that we do. So thank you again so much, guys, for your support. Have a great Thanksgiving. If you're in the United States and you're listening to this, have a great Thanksgiving tomorrow. We're going to have a big family get together up in Long Beach, California. So we'll be going there and having Thanksgiving. So I hope whatever you do is great and you enjoy yourself. And let me know if you have any questions about any of the products or any of the things that we talk about. Please let me know. And then if you want to go further, I really encourage you guys to join up at the Extreme Health Academy. This is like our flagship. This is where we take all the principles of our show and go much further. And what's cool is that I can bring a lot of these ideas to the table in there. I answer questions in there. I do a lot of work with people in the forums, and I love going back and forth and presenting solutions that a lot of people don't talk about. So it's just a lot of fun, and I think you would love it. I really, really do. It's a great community, lots of amazing people supporting each other. So check out the Extreme Health Academy if you guys want to do that. There's a free 14-day trial. If you're watching on YouTube, there's a link down below. The code is EHR14 to get 2 weeks for free. All right, my friends, love you a lot. Have a great Thanksgiving. I'll see you Friday morning, 10:45 a.m. Pacific time. Thanks for joining us on this show, episode 643. We'll put all the show links at extremehealthradio.com/643. And we'll see you on Friday, 10:45. And thanks for joining us, guys. Have a great Thanksgiving. Talk to you soon.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse